vata has to be reduced. So you take these medications. Sir, what about the anti-epileptics the neurologist has given? No, those are all not required. You don't have to worry about those things. And now if I go to a yoga person, the yoga person says something else and he says you meditate, you do this asana, do that asana. So it's like you are, hopping from one system of medicine to another system of medicine. This is a cafeteria approach. Ultimately, the patient is confused, don't know whom to believe, what to believe. Now, what should he take? What happens is, okay, what is the, ultimately they end up going to certain places where, immediately after stroke, what they give, some fish medicine, that medicine, this medicine, he gets misguided by the WhatsApp university or whatever university it is. So, to avoid that, in NIMHANS what we do is, the psychiatrist, the Ayurveda physician and the yoga expert, they sit together and see the patient. This is the first form of integration which we are following. So all three of them sit together and listen to the patient's history. Now amongst them, once they listen to the history and do the examination, they decide on what would be the best combination of all three, all three forms of medicine. So this is the first form of integrative approach which we follow at NIMHANS. Next. So just to give an overview, we have 30 inpatients and 3 OPDs in a day, in a week. Next. Next. These are all very familiar to you. Next. 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 So the idea of putting this statistics is not to show off that we are seeing so many patients or anything. Our OPD started in October 2019. As you can see, there is an increase in the trend of patients, what we are seeing, increase in the numbers. So basically what I mean to say here is, first, there was a lot of resistance, both internally and externally. There was a lot of resistance, but eventually when based on the feedback the patients gave, there was a gradual increase from the public as well as within NIMHANS of referral of patients. But fortunately or unfortunately, most of it are public referrals what we get. But we are also getting a lot of internal reference nowadays. This stats is only till 23rd August 2023. After that, we still have to compile it. Next. The same goes to inpatient or the referral trends in the OPD as well. So majority are self-referrals, but as you can see, the referrals from other departments are also increasing. Next. Next. Yeah, we do conduct a lot of yoga sessions, for different disorders. We have different modules of yoga. So I'll not go deeper into this. Next. Next. Yeah, this is inpatient statistics. So far, I think we have crossed 600. This is a slightly older data. As you can see, the admissions also have been increasing as the time advanced. So people have faith in integrative management and they have been coming as well as bringing their friends, relatives, etc. And slowly the referrals from Department of Psychiatry and Department of Neurology and Neurosurgery has shot up in the last few months. Next. Next. Yeah, so this is the word cloud which represents what are the predominant diagnoses which we see in the Department of Integrative Medicine. There's mainly in psychiatric disorders, it's schizophrenia, depression, anxiety and those kind of things. And when it comes to neurological disorders, it's the lumbar radiculopathy which trumps all other disorders. And then comes the cervical spondylosis and Duchenne's muscular dystrophy and stroke, and these are some of the common neurological disorders. Next. So the low back ache. Next. Yeah. So here I would like to spend a couple of minutes. So as you can see in the low back ache, patients with low back ache, majority of them are referred by neurosurgery department, where they think that surgery might not be required for these subjects. And if you tell these patients you do not require any treatment, you just do physiotherapy, majority of them don't do it. But doing surgery has not much of prognosis in such patients. So such patients are sent to us, and we found a significant improvement in their system, in their symptoms. As you can see, the visual analog scale, there is a significant reduction. Now let's say it's very subjective. You can see the prominent scales which are used to assess the pain and dysfunction in low backache, that is Oswestry Disability Index and Roland Morris Disability Index. There is a significant reduction in the symptoms. Next, similarly, when we go to anxiety, depression, already Dr. Umesh told you, this one is schizophrenia. Schizophrenia is a very heterogeneous disorder, a very difficult disorder to treat. That's because there are antipsychotics which do control, and 70% patients with schizophrenia respond. There is a 30% chunk of patients who do not respond to multiple antipsychotics. So such patients, especially there is a symptom called as negative symptoms and cognitive symptoms. So there are three symptoms: positive, negative, and cognitive symptoms. These negative and cognitive symptoms are not amenable to pharmacotherapy. And all these patients, what I am showing you here, are treatment-resistant patients. That is, those who have been tried on at least 2 antipsychotics, but not with a significant improvement. Okay, so such patients were referred to us. Such patients were referred to us, both inpatient and outpatient. As you can see, there is a significant reduction in the positive symptom score as well as the negative symptom score, which is, any change in such patients is thought to be or found to be very significant, because the improvement in a treatment resistant patient is actually a kind of a miracle. Next. Now, coming to training and human resource development, so I want you people to please carefully look at this. We have a MD course where there are 4 seats per year. So it's called Ayurveda Vachaspati Manovigyan Evam Manasaroga. So this is for post BAMS candidates, and this is the 3rd year we are running this course. So we already have 4 people, 4 people, right? 4. Yeah, we already have 4 MD graduates. One batch will be graduating next year. So please spread the word. Okay, this MD Manasoroga is there at NIMHANS, and we also have postdoctoral fellowship in integrative mental health and neurosciences. This is specifically for post-MD Ayurveda candidates. Okay, this is a 1-year fellowship where you will get adequate training and exposure in various psychiatric disorders. And we also have PhD in integrative medicine. So this is usually a sponsored post, that is, either you have to be working in a project or something, and you will have opportunity to do PhD after clearing the exam. So the need for stressing this is just by giving clinical treatment, we might not be able to achieve all that we need in integrative medicine. So educating people in a proper way about Manasaroga or the neurological disorders is the need of the hour. So that is why all these courses were started, so that the education can be given in a proper manner. Next. And there are several certificate courses as well, especially one which has become very popular is certificate course in integrative medicine, the last one. Next. So wherein very renowned. So why I am saying integrative medicine is need of the hour is, we realized it from many of the CCIM courses, participants. Many were senior psychiatrists, some were senior neurologists who were very keen on understanding Ayurveda and yoga. So they always had a inclination towards it, but most of the times they were not able to get a good